Did your stock just drop off a special delivery? Are you wondering what to do next? Don't worry, we've got you covered. But before we dive into this exciting, sometimes messy but always rewarding world of newborn care, please hit that subscribe button. We have tons of useful content coming your way and we don't want you to miss it. So let's get started with our top tips on how to take care of a newborn baby. 1. Getting to know your baby. We all know that stepping into the world of parenthood can feel a bit like stepping onto a new planet. And your newborn? Well, they might seem like a cute little alien with their own set of fascinating and, let's be honest, slightly confusing behaviours. But don't worry, we're here to help you decode the mysteries of your little baby. First up, let's talk about crying. You might have noticed that your newborn's cries don't come with tears. No, your baby isn't practicing their acting skills. Newborns don't actually produce tears when they cry. They have tear ducts, but they're not fully developed yet. So they save those real wet tears for when they're a little older and they really want to make you feel guilty. Until then, you'll have to rely on their powerful lungs to know when they're upset. Now let's move on to those little sneezes. If you're a new parent, every sneeze might send you running for the thermometer. But hold on, newborns sneeze a lot, and it's not always a sign of cold or allergies. Their tiny nasal passages are just getting used to the world around them, and sneezing is a natural way for them to clear their noses. So unless your baby has other symptoms, like a fever or runny nose, there's no need to worry. Understanding those little quirks of your newborn can help you feel more confident and less stressed as a new parent. Remember, every baby is unique and may not follow the typical patterns you read about in books or online. That's okay. You're learning about your baby and your baby is learning about the world. It's a journey for you to take together. Next up, sleep. Alright, let's talk about one of the most coveted commodities in the world of new parenthood. Sleep. Yes, those precious peaceful moments when your little one is off in dreamland and you can finally catch your breath, or better yet, catch some Zed yourself. Here's the thing about newborns. They sleep a lot, up to 16 or 17 hours a day. But before you start celebrating, let's add a little caveat. They usually sleep in short bursts of 2 to 4 hours. So if you're dreaming about catching up on your favourite Netflix series or enjoying a full night's sleep, you might want to put that on hold. Whilst the erratic sleep schedule of a newborn can be challenging, there are ways to manage this. Establishing a sleep schedule can be a game changer. In the early days, your baby will sleep and wake up around the clock, driven by their need to feed. But as they grow, they'll start to sleep for longer stretches. This is where you can start to gently guide them towards a more regular schedule. Start by observing your baby's sleep patterns. Do they tend to sleep more during certain parts of the day? Do they show signs of sleepiness around certain times of the day? These can be cues to start establishing a routine. You can also help your baby distinguish between night and day. During the day, keep the house bright and don't minimise normal daytime noises. At night, keep the lights dim and the environment quiet. Over time, your baby will start to understand the difference. And remember, it's okay to sleep when your baby sleeps. In fact, it's more than okay, it's recommended. New parenthood can be exhausting, and it's important to remember to rest when you can. So don't feel guilty about napping during the day or going to bed early. You're doing important work and you need to take care of yourself too. Remember, every baby is different and what works for one might not work for another. But with patience, observation and a little trial and error, you'll find what works best for you and your baby. 3. Feeding your baby. Breastfeeding can be a beautiful bonding experience, but it can also be challenging. It's perfectly normal to have some difficulties at first. Don't hesitate to ask for help from a breastfeeding consultant or your midwife. Formula feeding, on the other hand, offers more flexibility. Anyone can feed the baby, which means you can share those 2 AM feeds with your partner. Feeding your newborn is one of the most fundamental aspects of newborn care. It's not just about nourishing your baby, but also about building a bond with them. Whether you're breastfeeding, formula feeding, or doing a mix of both, remember, it's all about supply and demand. And trust me, your little one can be very demanding when it comes to meals. Breastfeeding is a natural process, but that doesn't mean it's always easy. It can be a beautiful bonding experience, holding your baby close and providing them with nourishment. But it can also be challenging, especially in the beginning. On the other hand, formula feeding offers more flexibility. With formula feeding, anyone can feed the baby. This means you can share those 2 a.m. feeds with your partner, or even get a helping hand from grandparent or a babysitter. Remember, it's a team effort. Formula feeding also allows you to know exactly how much your baby is eating, which can be reassuring for parents. And while it may not offer the same skin-to-skin contact as breastfeeding, you can still create a strong bond with your baby during feeds by holding them close and making eye contact. Whether you choose to breastfeed, formula feed, or do a mixture of both, remember that the best choice is the one that works for you and your baby. Every family is unique, and what matters most is that your baby is being fed and loved. Changing that nappy. Diaper changing, or nappy changing, depending on where you are from, will be a task you'll become an expert in no time. I know, most people dread the thought of nappy changing, but trust me, you really do get used to it, and quicker than you might think. Before you know it, you'll be able to change a nappy with your eyes closed. Well, maybe not literally, that's not advised, but you get the idea. Now here's a little heads up. The poos for the first few days or weeks can be black. Yes, you heard right, black. It's called meconium, and it's completely normal. It's made up of stuff your baby ingested whilst they were inside the womb, like amniotic fluids, skin cells and water, so don't be alarmed when you see it. When it comes to changing diapers, preparation is the key. Always have your supplies at hand before you start. A clean diaper, wipes, diaper rash cream. You don't want to be caught in a situation where you've removed the dirty nappy only to realise that the clean ones are across the room. Trust me, it's not a fun situation to be in. And here's a crucial tip. Always remember to wipe from front to back, especially for baby girls. This helps to prevent the spread of bacteria and reduces the risk of urinary tract infections. It might seem daunting at first, but remember, every parent has been there. Bath time. Bathing your newborn can be a fun and bonding experience. It's time for gentle splashes, adorable rubber ducks, and even a bit of singing if you're up for it. But let's be honest, it can also be a bit nerve-wracking, especially the first few times. Your baby is so small and delicate, and when they're wet, they become a tiny slippery bundle. But don't worry, with a little preparation and care, you'll soon become a pro at bath time. First things first, gather all your supplies before you start. You'll need a baby bathtub or a clean sink, a soft washcloth, a soft fluffy towel. Having everything at hand will make the process smoother and less stressful. Now here's a crucial tip. Never ever leave your baby unattended in the bath, not even for a second. If you need to answer the door or grab a towel, take your baby with you. Safety always comes first. When you're ready to start, fill a tub or sink with about 2 or 3 inches of warm water. Test the water with your elbow or the inside of your wrist to make sure it's not too hot. Then gently lower your baby into the bath, supporting their head and neck at all times. Use the washcloth to gently clean your baby, starting with their face and moving to the rest of their body. Remember, newborns don't need to bath every day. 2 to 3 times a week is enough. When bath time is over, wrap your baby in a soft towel and gently pat them dry. Make sure to dry in between the folds of their skin. And there you have it, a clean, happy baby. Baby proofing. So now it's time to talk about baby proofing. Your home, which was once your cosy abode, is now your baby's first playground. And as exciting as it is to watch them explore, it's equally important to make sure they do it safely. First up, let's talk about sharp corners. Coffee tables, TV stands, fireplaces, they all have corners that are just at the right height for your little one to bump into. So, cover those sharp corners with some corner protectors. They're easy to install and can save your baby from a lot of unnecessary bumps and bruises. Next, secure heavy furniture to the wall. This can include bookcases, dressers and TVs. As your baby starts to pull up and climb, these can pose a tipping hazard. Furniture, straps or brackets can secure them items and give you peace of mind. Now let's talk about small objects. Babies are curious creatures and they love to explore with their mouths. So keep small objects out of reach. This includes coins, batteries and small toys. Regularly check the floor and other surfaces that are within your baby's reach. And remember, babies are like little explorers, so if there's trouble to be found, they'll find it. So keep cleaning supplies, medicines and other potentially harmful substances locked away or in high cabinets. Baby proofing might seem like a daunting task, but take it one step at a time, start with the most immediate risks and work your way from there. And remember, the best baby proofing is active supervision. Keep an eye on your little one, especially as they become more mobile. Common newborn health concerns. Let's move on to a topic that's often on the minds of new parents. Common newborn health concerns. It's natural to worry about your baby's health, but remember, newborns can have some quirks that might seem strange but are actually quite normal. For instance, it's common for newborns to have some skin peeling, especially on their hands and feet. This is because they've spent 9 months soaking in amniotic fluid, and now they're adjusting to the dry air outside the womb. This usually resolves on its own within a few weeks. Another common concern is jaundice, which can make your baby's skin and the whites of their eyes look slightly yellow. This is caused by high levels of bilirubin, a substance produced by the breakdown of red blood cells. Mild jaundice is common and usually resolves on its own within 2 weeks. However, if your baby's jaundice is severe or lasts longer than 2 weeks, it's important to consult your doctor. However, there are some signs that you should never ignore. If your baby has a fever, isn't feeding well, or seems unusually fussy or sleepy, it's important to call your doctor. These could be signs of infection or other medical condition that needs immediate attention. Trust your instincts, you know your baby best. If something doesn't feel right, don't hesitate to seek medical advice. It's always better to be safe than sorry. Remember, it's normal to worry about your baby's health, but also remember that you're not alone. Your midwife or health visitor is there to help you navigate these early days and to ensure your baby is healthy and thriving. So, don't hesitate to reach out with any concerns or questions you might have.